Hello, I'm Dr. Charles Modlin. I'm the Vice President and Chief Health Equity Officer at Metro Health. I'm also a staff urologist and a kidney transplant surgeon. And over the past 30 years, I focused my passion and efforts and career to improving the health of the community and the elimination of healthcare disparities. Ladies and gentlemen, esteemed colleagues, and to you out in the community, as we gather to commemorate the 2025 Martin Luther King Jr. Day, we reflect not only on Dr. King's profound legacy, but also on the ongoing struggles for equality that persist even today in our society. Dr. King once said, "Of all forms of inequality, injustice in health is the most shocking and the most inhumane." Well, these words resonate deeply when we confront the stark health disparities that continue to disproportionately afflict and affect African American populations compared to their white counterparts. To start, let's define health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible, regardless of their race, ethnicity, or socioeconomic status. Yet the reality is that we are far from achieving this ideal. Statistics reveal a troubling narrative. African Americans face significantly higher rates of chronic diseases, including, for example, hypertension, diabetes, kidney disease, and heart disease, and other conditions. For instance, the prevalence of hypertension, high blood pressure among African American adults is approximately 50% compared to only about 28% among white adults. Diabetes affects 12.1% of all African Americans compared to only 7.4% of whites. When it comes to cancer, African American men have a 25% higher cancer mortality rate than white men. The disparities extend to mental health as well, with African Americans facing higher rates of depression, yet African Americans are less likely to receive adequate treatment. This disparity is evident even in our black children. Black children are more likely to suffer from conditions such as asthma, obesity, and behavioral issues, often exacerbated by environmental factors and access to care. The causes of these health inequities, health disparities, are multifactorial. They stem from systemic racism, socioeconomic factors, and barriers in access to health care. Limited access to quality health care, lack of health insurance, and the absence of culturally competent care all contribute to these inequities. Moreover, social determinants of health like education, income, and neighborhood conditions play a crucial role in shaping our health outcomes. The consequences are dire. Health disparities cost our nation over $480 billion annually and result in premature deaths and lost lives. African American men have a life expectancy of just 70.8 years compared to 76.3 years for white men. African American women live an average of 78.5 years, while white women live to 81.2 years. Furthermore, the maternal mortality rate for black women is nearly 3 times higher than that seen in white women, highlighting an alarming inequity in maternal and infant health. The existence of these health disparities is a stark reminder that we have not yet realized Dr. King's dream of equality and justice for all. Health equity is not just a health issue. I contend that it is a civil rights issue that demands our urgent attention. So, as we reflect on Dr. King's vision, let us also look towards solutions. We must engage in community-driven efforts that address these health disparities head-on. Innovative programs like the Cleveland Clinic and Metro Health Minority Men's Health Fairs and the Multicultural Health Equity Centers of Excellence are steps in the right direction. These initiatives focus on prevention, education, and community engagement in providing access to culturally competent care. We must advocate also for policies that expand access to health care, enhance education on health issues, and improve the socioeconomic conditions of underserved communities. Moreover, we need to raise awareness about the importance of diversity in our healthcare workforce, ensuring that all patients see themselves represented in the care and the caregivers they receive. So, as African Americans, as America becomes increasingly diverse, the health inequities we face represent not just a societal failure, but a national crisis state. Soon minorities will comprise the majority percentage of our nation's population, and therefore we must act now to ensure that all Americans can experience the justice and equity that Dr. King envisioned. So in the spirit of Dr. King, let us unite to alert our nation about this health equity crisis. It is a crisis. Together we can introduce best practices, engage all sectors of society, and enact solutions that dismantle these inequities. As Dr. King said, injustice anywhere is a threat to justice everywhere. Let us strive to create a healthier, more equitable future for all, so that ultimately we can realize Dr. King's dream. Thank you.